You are a star, so act for the person.
You gonna video me with my walk on the side of my head? Yeah. All right. So we're gonna do hand and nail care. Oh God, everybody has just a big eye. Oh my goodness.
You gotta put your shit in.
Well, you know you gotta come dressed up and you know. So you gonna be videotaped.
What got you in your goodness?
Come on, child.
Oh, get up. Okay, stick with you.
Tired?
Go ahead, girl.
All right. So now we're gonna do hand and nail care. All right, for the client. So you're still gonna do everything that you normally do with the IC, indirect care. You're gonna knock on the door. You're gonna come in. You're gonna introduce yourself, name and title. You're gonna address the patient by name and let them know why you're here. You're gonna do hand washing technique. After you do hand washing technique, you're gonna come back and ask the client if you could check the ID to make sure he or she is the correct client that you're giving the skill to. After that, you're gonna gather your equipment. After you gather your equipment, you bring it to the patient. You don't have to deal with the bed because the patient is going to be sitting up in the chair. But you do still have to provide the privacy because there's another person in the room and they don't need to see what you're doing to the client. You're going to get some water, ask the client to check the water, make sure the water's not too hot. If the water's okay, you're going to proceed. You're only going to soak one hand for state board. In real life, both hands will go in. But for state board, they only want you to do one hand. So you're only going to do one hand. So the patient's going to be soaking.
You need to put glove?
No. So, for this skill, you have around, I believe, 8 to 11 minutes to complete the skill. It's not a hard skill. It's very easy and quick. You're going to have 2 washcloths, and you're going to have a face towel. You're going to have 1 washcloth. And of course, that is to wash the hand. You still got to do the mitt, as always. You're going to have your soap, and you're going to wash. What are you going to wash? You're going to wash the top of the hand, the inside of the hand, in between, and you're going to clean all the nails. And you're going to rinse. Everything, of course, with your rag. After you wash and you rinse, it stays in here. You're going to open this up and I'm going to bring it to the client. I'm going to put the hand so you can dry the hand. Alright, so you're going to dry the hand. After you dry the hand, you have to do a couple of things to the hand. This is called an orange stick. An orange stick. One side has a point. The other side has an oval. Point and an oval. The oval side is what you're going to use. The oval side. You're going to now clean underneath the nails. You're going to take the oval side and you're going to wipe underneath the nail and you're going to wipe it on the clean washcloth here. You're going to do that for each individual nail. For each individual nail. After you do all the nails, then you're going to file. When you file, you're going to file straight across in one direction. Don't go back and forth. That rips the nail. We don't want to do that. We want to file just enough to make the nail smooth and get any chips or any cracks off because, you know, the patient scratches a lot and you don't want them to what? Scratch up their skin. You don't want to have any cuts or any lacerations in the skin because that promotes what? A bed sore and infection, and we don't want that. So you're going to file in one direction. You can do it once, twice, 3, 10, I don't care. As long as you only go in one direction. Then remove any dust, if there might be, from the filing. Lotion, put the lotion in your hand. Warm up the lotion, and you're gonna put the lotion on the whole hand. Don't go up here. No, from the wrist down. This is not the nail salon. Don't pull the fingers. Don't bang on the hand like the Korean like. Just put the lotion. If you feel there's too much lotion and the lotion is not going away, get it. Dry some of the lotion off. Alright? That's all you need to do. You're going to remove this out of the way. Ask the client if they're okay. You're going to give them their doorbell. You're going to open up the curtain. You're going to get rid of all of this. What are we going to do? This, and this goes in the hamper. All of this is personal equipment. It goes in her drawer. You're going to get rid of this. You're going to wash it, dry it, put it back underneath her nightstand. Put this in the drawer. This goes in the garbage. Come back to the client. Make sure that everything's okay. Your hand washing, and tell the proctor that the skill is complete. Any questions?